Who is joining us for the webinar. We're going to get started in just a few minutes. Okay, so as always, we have a wonderful panel. We have a lot to talk about today, so I think we will go ahead and get started now. So hello, everyone. My name is Kalia Souza, and I'm the Food System Equity and Advocacy Specialist for Michigan State University Center for Regional Food Systems. And again, thank you for joining us. Just so you all know, our center convenes the National Work Group, Racial Equity in the Food System, or REFS, community of cooperative extension professionals and community stakeholders who connect, learn, and collaborate to facilitate change within our institutions and society to build racial equity within the food system. As we're getting started, please feel free to use the chat box and let us know who you are and where you're joining us from. Today's webinar is the final session of a three-part series focused on building more equitable SNAP-Ed collaborations among land-grant universities and state and community partners. Our first session focused on SNAP-Ed federal funding equation and how state allocation decisions can inform and impact collaboration among stakeholders, as well as opportunities to advocate and organize for more equitable participation and collaboration in SNAP-Ed. Our second session focused on the intersection of collaboration with community food access, nutrition security, and culturally appropriate education. And today, we'll talk about structures and approaches that support equity in SNAP-Ed and innovative models of collaboration. At the very beginning of this series, I'll also note that I shared a little bit about how it was almost a year-long process of REFs engaging in conversations to identify challenges across the land-grant university system and opportunities for deeper relationship building at the intersection of racial equity and food systems. So we've heard from the USDA, national associations, land-grant universities, state agencies, and community-based organizations. And all those webinars are available on our REFs webpage, which perhaps Rachel could help me out by dropping the link into the chat to our Racial Equity in the Food System Work Group page. We do hope that this series has been enlightening and inspiring, but even more so, the aspiration is for this series to spark action. A more equitable system of collaboration is necessary for SNAP-Ed programming that is at minimum effective and at its best transformative. And although this is the end of this REFs hosted series, we are working with partners in the background to do exactly what we hope to see, carrying this effort forward with intentional equity-based action. And we'll keep you all in the loop as that progresses. Now, before we get to presentations, the usual housekeeping items, this session will be recorded and all materials will be shared with registrants in a follow-up email within a week of this webinar. We have time set aside for audience questions at the end of our panel presentation. So I do encourage you to ask your questions in the Q&A box, not the chat. Our panelists may answer some of your questions directly there, and we'll answer some of your questions live. And now we're going to transition to a quick poll that we run for each of these sessions to find out about all of you. So, which statements describe your relationship to nutrition incentive? Nutrition incentives is where I used to work on things. Nutrition education programming. So we'll give you all just a minute or two to respond to that poll. And we've already got a couple of answers rolling in. And I see we've still got people introducing themselves in the chat. Thank you, everyone. Keep the conversation going there too. All right, we've only almost got 3/4 of you responding to the poll. Give this a little bit more time. And I'll just note that if you chose other on here, you are welcome to give a little bit more information on that in the chat if you'd like to. Okay, just a few more rolling in. We'll give it a couple more seconds. All right, Marie, let's go ahead and share those poll results. So it looks like nearly 40% of you work at an 1862 land grant university. And then we almost have kind of an even distribution for organizations that aren't part of land grant university, or perhaps you're partnering with an organization or institution that implements nutrition education, or you're not currently implementing any of that yourself. And then we've got a good amount of those who answered other in the chat box as well. So thank you all for participating in that poll. With that, we're going to move over to speaker introductions. And we'll start off with Teresa Jackson, who is Mojave, Seminole, Muskogee Creek, Cherokee, and Yuma. She's a registered dietitian, nutritionist, and licensed dietitian who serves as the Tribal Partnerships and Outcomes Partner for Oklahoma Tribal Engagement Partners, or OCTEP, in Stillwater, Oklahoma. And Teresa, feel free to correct me if I should say OCTEP or OCTEP. But she facilitates the extension of programming to tribal partners, coordinates community events, develops culturally relevant programming, and participates in qualitative and quantitative evaluation methodologies. Her passion is community nutrition, and she hopes to empower others to lead healthier lives through sound research and shared learning. And Teresa currently serves as the Association of SNAP Nutrition Education Administrators, also known as ASNA, Leadership Team Senior Co-Chair. Latrice Davenport is the SNAP Ed Program Manager at the Georgia Department of Human Services and the Division of Family and Children's Services. Latrice has 10 years of public health program management experience, and she's the current co-chair of ASNA's Race, Health, and Social Equity Committee. She previously served as the ASNA leadership team, or on the ASNA leadership team, and as the president of the Georgia Society for Public Health Education. And in her free time, she enjoys reading and spending time with her family and friends. Janice Simon is a member of the Kickapoo tribe in Kansas and grew up on the Kickapoo reservation with the help of her dad, mom, and 8 siblings. And she graduated from Baker University in the early 80s. Janice has decades of experience working with tribal programs from government, grant writing, and managerial and frontline workers to promote the betterment of tribal communities. And then last but not least, Tandy Rundis is a registered dietitian and regional specialist for K-State Research and Extension SNAP Ed program. Tandy provides technical assistance and support to SNAP Ed staff in the northeast part of Kansas. And she believes relationships are the key to collaborative work that advances health for all. As a wonderful transition into our presentations now. And Teresa, I'll hand it over to you to start us off.
Great, thank you. I am with Oklahoma Tribal Engagement Partners, and we do say OKTEP when we're using our acronym. So just as a little FYI, I am going to lead us off and talk about the organizational structure that we have here at OKTEP. And we are one of 4 implementing agencies in the state of Oklahoma for SNAP Ed We are the newest implementing agency. We were founded in 2017, but all of our leadership, most of our team comes from other implementing agencies, some of them in a university setting, a land-grant university setting, and then others at a tribal nation that is also an implementing agency here in Oklahoma. So we formed with a wealth of expertise and knowledge around SNAP-Ed and being an implementing agency. Our primary focus to get OKTEP started was seeing a need to partner and further the work with SNAP-Ed in the state of Oklahoma. As many of you probably know, we do have a tribal sovereign nation implementing agency. And of course, they cover about a quarter of the state of Oklahoma, but we have a lot. We have 38 other federally recognized tribes in Oklahoma. So there was really a need for us to further the work and engagement with tribal partners in our state. So that's a little bit of background as to how and why we got started. Next slide. My first few slides, I wanted to give a little bit of a foundation of, again, the knowledge and the mindset that we formed with all of our work at our previous institutions and tribal organizations. We always held these beliefs, but it was just really important for us to put these at the forefront when OKTEP was formed. And so we go back to a lot of the work from Chino and DeBruin here from 2006, where we know that mainstream models and programs too often assume that our tribal community members and practitioners can immediately begin to resolve an issue without paying attention to the social, cultural, historical, and political environment and the time needed to build effective working relationships. So we started in 2017, but prior to that, we were already laying the foundation, the groundwork for how to collaboratively and engaging partnership with tribal nations in Oklahoma. A lot of our team have nutrition backgrounds, but we have some with the anthropology background, public health, kinesiology. We have a host of background and training and education on our team. And so what you'll see is how we really use all of that to come together and do the work that we do, engaging with tribal nations here in Oklahoma. Next slide. So this is from the NIMHD Scientific Advancement Plan. And again, just some foundational words to share about how we want to strengthen the research and evaluation reporting of the work that we do with tribal populations. I think apart from helping that to create meaningful, lasting improvements in equity and health, that also helps us to expand the diversity in our in the work that we do and the workforce that is around SNAP-Ed and health equity. All right, next slide. So this is from the National Institutes of Health. Again, some words that really are at the heart of the work that we do here at OKTEP. So aside from working and doing research and programming with Native American tribes around nutrition and health equity, we also work to disseminate that research in forums such as these, but also different position papers and also research papers as well. We try to present and share the work that we're doing, because ultimately that is at the heart of equity, is learning from each other and sharing, helping for all of us to do better, because that's how we can really have the most collective impact towards health equity for our tribal audiences. Next slide. So this is where I'm really going to dive into what our organizational structure is here at OKTEP, because it is, I would say it's out of the norm. A lot of the times it's really hard to explain it to folks. And so we do have an organizational chart that I'll share with you all in just a minute. But I like to just kind of set the stage and say that prior to OKTEP, the institution and tribal nation that I worked for had an organizational structure that looked very much like this. Your traditional structure where there was a top-down approach. There could be, the person in that top tier, and yes, this is a blank structure. There are no names, no positions filled in, because I just wanted to show this as an example. And it may be very similar to the type of organization that you're working in now, where there is someone at the head. There is someone who has maybe a senior title, a director title, and then there are some mid-level folks who may have a host of different titles like coordinators or specialists, or just all the different titles that you see in that midline. And then we have those frontline employees that are really the ones that are the boots on the ground, the ones carrying out programming, and really the ones who have the most opportunity to set those relationships with our communities, with our tribal members. There could be, there's lots of different variations of this type of structure, but let's just kind of, for the time being, think of traditional organizational structure as something that looks like this, where there's a top-down approach. So next slide. This is what we refer to as OKTEP's organizational structure or org chart. Most of you know, when you're applying for grants and doing different work with different organizations, a lot of the times you are asked to provide an organizational chart. When we first were founded in 2017, it was hard for us to come up with what one would look like, because we knew that we weren't subscribing to that traditional organizational chart. And so a lot of great minds, and then our wonderful, talented graphic designer and communication specialist put this together for us. And so we have since been using this, you can see, since 2020 as OKTEP's organizational chart. And then, when we talk about it, it's hard to really help paint that picture. But you can see, those of you that are familiar with the socio-ecological model, we drew a lot from that in terms of the circles that start with the smallest in the middle and then grow bigger and encompass more and more broad topics as you go out from that central circle. Then on the outside, you can see where we have, kind of the pillars, the things that are helping to encompass the work that we do, are social justice and also racial justice. And there at the bottom, you can see we have our principles of practice. And so they're numbered 1 through 5, but they are really coming from the work from Dawn Satterfield and Lamira DeBruin. And they are from the Native Diabetes Wellness Corporation, and they are Native Diabetes Wellness Program, and they from the Center for Disease Control and Prevention. And so those are the things that we continuously go back to with our principles of practice. So consulting our tribal leadership and people, truly authentically listening and respecting and integrating the Native knowledge that is shared with us from those tribal leaders and tribal community members. Of course, honoring tribal processes, which here in Oklahoma can look a variety of ways, because there are so many different tribal nations here in Oklahoma. The fourth one is working with integrity, generosity, and sharing what works. And we also know that sometimes what works for us won't work for others. And then what works for us one day may not work for us next week. And so just continuously looking at those processes and knowing that we have to be flexible in the work that we do. Then the fifth one is respecting the power of our words. So keeping our words. Again, I share how a lot of the work that we did started prior to 2017, because it does take time to build those respectful listening relationships. And I think that it's important that, we always respect and keep our word, because knowing that history of tribal nations in the United States, that hasn't always been the case. And so I think it's important that in everything that we do, even though we may surfacely not think that nutrition education and health equity has a lot to do with what happened in the past, it really does. And it still does, because of the relationship between sovereign nations in the US and the US government. And so it's important that, that's something that you always keep in the back of your mind and continually update yourself, on the political environment between our nations and the federal government. So those are the principles of practice, but you can see the big overarching top of our organizational structure says community of practice. So most of you are familiar with that, and I think that that's how we best describe our organization, because ultimately we are working for health equity in Indian country through a variety of change efforts, including policy, system, and environmental change efforts. But really, we get to really help support our tribal communities and uplift the culturally positive and relevant program that's already happening, but then also those traditional life ways that are empowering, and we know that they are at the heart of health equity. And so I think that that's where culture has such a big piece in the work that we do. That's kind of the overall, and I wanted to kind of dive deep into each of those things a little bit. Can I have a minute? Just sorry, only one in the office today, and we're getting a big delivery. Sorry. So the big things that I kind of wanted to touch on in the next few minutes that I have are about the 3 L's that you can see there on the left. So leadership, locations, and language. And so next slide. The leadership and location. So here you've got a map of the state of Oklahoma, and you can see the 39 different sovereign nations are highlighted in a different color. And those are the various tribal jurisdictions. And so those are called reservations in other areas of the US. Some of our nations are going back to calling their tribal jurisdiction a reservation. So we fully support that. But then some also refer to them as tribal boundaries. And so each of those nations really provides services to their tribal members and other Native community members living within those boundaries or jurisdictions. And so that's kind of what we stick to when we work with our with each partnership in Oklahoma. So when we have our educators doing the frontline work, those positions are not just located with our main office. So our main office is in North Central Oklahoma, Stillwater. Many of you are familiar with Oklahoma State. So we are actually not in any tribal jurisdiction, which is a little odd considering the work that we do. So it's just our main office. There's a few of us here, but all of our other positions are located within those tribal communities. Because we know that that is the best way for the work that we do to be fully integrated and engaging with each of those communities. And so the supervision for our positions doesn't reside, from that top-down approach. It's not the folks in our main office. It's actually our tribal partners who are providing, the help, the day-to-day resources and things that our staff may need as they're doing their jobs. And so that's, I think, something that is really a little bit out of the norm, because most leadership is, a central office and everyone works out of that same office. And so that is definitely not our setup with OKTEP. Next slide. The other thing I wanted to highlight is the language that we use. And so these are just a few examples of how we've really tried to shift and change the way that things are done within OKTEP. So of course, we were used to having to have an annual performance evaluation at our previous organizations in tribal nations. So now that is termed an annual review. And it's not a traditional review where it's a supervisor and the employee. We're getting input from pretty much anyone who wants to provide input, anyone who has worked with that staff member throughout the year. And not only is it kind of feedback on that staff person's day-to-day, their job responsibilities, but it's also highlighting their accomplishments. It's asking what a staff member's goals may be for the next year, for the next 3 years, or however far out we want to go. It's also asking for feedback on challenges, things that OKTEP as an organization could do better, but then also asking about training, what areas would you like to develop more in, that OKTEP can support to help, again, develop those leaders, because we know that ultimately a staff member may not work for OKTEP forever. We hope that they do, but we are also thinking about bigger picture. So let's develop all of our staff and have them equipped, if the time comes and they want to go to some other organization. We want to make sure that they are, the best version of themselves that they can be, and that we have equipped them well. So for all of our team members, I wanted to add that point because, again, this is not just for, what's traditionally considered our frontline staff. We recently have started piloting a process for our main office team members as well. And so, that has been a little bit of a struggle because I think our staff, our health promotion partners are still really used to having had a job in another organization, or the way that they were taught in school, that, it's a supervisor, it's a director, it's a leader, at the top of an organization that's providing feedback for you, that you don't get to provide that feedback for that supervisor. So we're really trying to shift that narrative and make it, equitable, the way that we do these reviews for everyone. So that is still a pilot process. I can say we started it 2 years ago, and both years have looked different. So we still have not landed on the best way for us to gather feedback for ourselves as well. The next thing that I'll highlight is our team member titles. So next slide. This was a little change that we felt like we could absolutely do, and it has been received very well. And so you can see that thinking about our frontline folks, prior to making this change, and it hasn't been quite a year. And so I did catch myself earlier on one of the other slides talking about an educator. That was the old title, is that we had educators. So now we have moved from calling educators health promotion partners. With each tribe, the tribe also provides input on what a team member's title will be. And so I say blanketly health promotion partners because at some tribes, they are specific to the programming that they implement. So it may be it may have been Eagle Adventure Educator, and now it's a Eagle Adventure Partner. Or if it's a nutrition and health promotion educator, it was changed to a nutrition and health promotion partner. So you can see that our health promotion partners who are specifically working with a single tribal nation or organization are the first 7. And we actually have 2 with one of the larger nations here in Oklahoma. And then we have 2 health promotion partners that are considered intertribal. They actually work out of our main office because the 5 nations that are listed there under the second bullet are in north central Oklahoma. And so it's a little more convenient. And for various reasons, when we were working on the partnership process, it was easier for them as a nation or a tribe to have someone kind of part-time. So not have a person, 40 hours a week dedicated to nutrition and health promotion. So that's also something that we've learned to be flexible with, is that each partnership and the way that we engage with each tribe has been different. But I think we love it because there are some things that we learn and that are very positive that we can sometimes implement with another nation or tribe. And so it just makes all of the work that we do with all of these tribes stronger and more equitable because of the lessons that are being learned along the way. Okay, so next slide. This is how we've updated our team member titles. So before we had directors, we had a SNAP Ed program director, we had coordinators. So that used to be my title. I was the Tribal Partnership and Outcomes Coordinator. But you can see we've updated all of our titles to have the word partner. So we took out the directors, we took out the coordinators, we took out the managers. We tried to get away from those traditional hierarchical titles, just again, to make it more equitable as an organization for all. And so you can see that, and let me tell you, we spent several meetings talking about what do we call ourselves, because some of us have, years and years of experience. And we really kind of had to step back and think, well, what is it that we're doing? And so you can see that the beginning of the title, really focuses on the job responsibilities, kind of what is our expertise. And so that's how we came up with these changes. And I know I say this is a little thing, but in your organization or at your university, this may be the hardest thing to get done. So maybe this isn't where you start when you're trying to incorporate equity into your organizational structure. Because I know if we were at larger institutions, it would not have been as easy as it was for us to make these updates to our team member titles. But it's just an example of something that we've been able to do here for us at OKTEP, and it has been working well. Okay, next slide. So this is, I'm wrapping up because I think I'm nearing the end of my time. Wanted to go over some other practices that could be done to promote equity and some more concrete examples of things that we're doing here at OKTEP. In terms of our meetings, we have a monthly team meeting, and we have quarterly meetings with our partners, includes all of our partners. Again, just trying to make sure that we're all communicating and working together. And so in terms of who leads those meetings and who creates the agenda and who takes notes, trying to be more equitable in those practices, we rotate. So we rotate who's leading a meeting. And a lot of the times it's not just one person, it's really topic focused on who's leading the conversation at those meetings. But we always all contribute. Our agenda is stored on a shared drive. And so it's the expectation that all of us contribute and add things to that agenda, and that we also all contribute and take notes or minutes on that agenda, so that it's not just, some one person's job. It's something that we can all do to promote equity. And then it also helps us when we hear things differently. And so I think it's also helped us to have more clear communication and clarify the things that are discussed in those meetings. Our interview process, where I think, and again, this is something that we could easily do here at OKTEP, and it may not be an easy change for you at your organization or institution, but we were able to open our interviews for potential staff members to additional team members. So it didn't have to be, what was considered managerial or supervisory positions. And so now we work to have a team, an interview team, and it changes. And so we have folks that would be considered peers. So we have some of our health promotion partners on that team, but we also have just folks that maybe aren't going to be working with that person directly, because sometimes that feedback is even more helpful than the folks who will be working with the person directly. Again, this may not be something that you could easily do at your organization, but we have a outside HR agency. And of course, everything was cleared with them beforehand. And they said, yes, you're not breaking any laws. You're not, you can absolutely do this. Here are the professional development things that we could offer to make sure that everyone who's going to be a part of that interview team feels fully equipped. So we did, go over, absolutely the things that you cannot ask about in an interview for legal reasons. We went over kind of just some of those basic things that, again, are helping to equip our team members with the skills and those professional development opportunities that will help them not only in this job, but in future jobs. Something else that we do is we always welcome new ideas. Again, we're very flexible. Our newest staff member, she commented that, and she's about 3 weeks in, and that was one of the things that she said to me last week. She said, you know what? You all are very relaxed and flexible. And I just thought, that's really good feedback. Thank you, because I think we are working to try to be, welcoming and relaxed. And we want new ideas, especially with our new staff members when they're learning the processes and the way that we do things. If they say, why do you do it that way? I always ask and I think, why do we do it this way? Do you have a better idea? Because we would love to hear it and we would love to implement that. So we're always welcoming to new ideas. And then again, we are questioning, the way that we do things, consistently, looking at our processes, kind of a quality improvement check, continuous quality improvement check. Why are we doing this way? Do we really have to? What benefit is it for the work that we do or for our organization? So I think that that's a big part of what helps us to try and make these small shifts or changes to be a more equitable organization overall. So next slide is just some of the resources and from the foundation info that I provided at the beginning. And so that is all that I have, and I will be turning it over to Latrice Davenport, and she is going to share with us how Georgia, the state agency, is going to or is incorporating equity into SNAP Ed programming. Thank you.
Thank you so much, Teresa. Let's see if I can share my slides. Oh, there you go. Right there. Oh, well, I saw it and I don't see them again.
Yeah, Latrice, you should be able to share your screen since we had a slight update to your slides.
Got it. Okay. All right. Let's hope that I don't have a very busy screen. All right. Okay. So thanks so much for having me. My name is Latrice Davenport. I'm the program manager at the Georgia Department of Human Services, Division of Family and Children's Services. And I'm going to talk a little bit about advancing equity from the perspective of a state agency. And I'll talk a little bit about that role as well. Our agency is headed by Commissioner Brose. We are under the Department of the Department of Human Services. So I'll give kind of a brief overview of our agency, where I sit within the agency, a little bit about our SNAP eligible population, how we've approached equitable programming, and some lessons learned as we have tried to expand our work into this area. So our vision is for safe children, strengthened families, and stronger Georgia. And our mission is to prioritize the safety of Georgia children and the decisions we make and the actions we take. We partner with families on their path to independence and build stronger communities with caring, effective, and responsive service. And so within the agency, kind of the broader Division of Family and Children's Services, there's two kind of major components, child welfare and the Office of Family Independence. And I sit within the Office of Family Independence in the Food and Nutrition Unit. In our unit, we manage the SNAP policy, CSFP, the Commodity Supplemental Food Program, the Emergency Food Assistance Program, which is administered by food pantries and food banks, SNAP Outreach, which is the federal program that partners with nonprofit organizations to assist clients in signing up for SNAP, and Community Partners, which is a program that we manage, which is across the state. And again, it really engages our nonprofit partners to assist clients in signing up for SNAP, TANF, and I believe Medicaid. And I sit within that agency. So those are our colleagues, and that is the work that we do in our unit. A little bit about SNAP in the state of Georgia. We have about 1.5 million SNAP recipients in the state. They've redeemed about $238 million in SNAP benefits. Most of our SNAP recipients are adults. About 44% are under the age of 18. So in the state of Georgia, I am at the state agency, and in that role, I manage and oversee the SNAP allocation, and then subcontract out to agencies to do SNAP on the ground. And so in the state, we have 4 implementing agencies. There are University of Georgia, Georgia Department of Public Health, Open Hand Atlanta, and Health Empowers. We also have a technical assistance partner, which is the Public Health Institute. And I'll talk a little bit about kind of their role in supporting some of our initiatives. Right now, we have about 500 sites in about 71 counties. And like I said, most of our work does kind of concentrate around Metro Atlanta, but we have some sites in our more rural parts of the state. And so kind of how we've approached equity is really kind of thinking through how exactly are we providing services to SNAP eligible people as much as we can. You know, how exactly are we creating programming that's culturally and linguistically relevant? And how exactly are we centering the voices of the most impacted in our program decisions? And so, you know, we've approached it in a couple of ways, and how how that's been embedded in our programming, we'll talk about in a little bit. So our goal, you know, some of our goals include, you know, disaggregating outcome and outreach data. We get that information, and we look at that annually. Been doing that for a couple of years now. How can we create opportunities to co-create relevant SNAP programming? So this really gets to the ideas around community engagement. How do we build, really building staff capacity to discuss and implement programming through an equity lens? So, you know, providing training, technical assistance, onboarding staff with talent in this particular area, and then using that data to really identify and address service gaps. So from our previous federal fiscal year that ended September 30th, we reached about 103,000 SNAP Ed residents through direct nutrition education. We completed about 8,600 classes. And we've also reached an additional, I believe, 90,000 people through our PSC efforts. So some of the activities that we have started to address equity in our programming, including, you know, how do we use our data? How can we address community engagement more authentically? How can we reallocate resources to fund more locally and regionally based community organizations? And how can we effectively train and build capacity within our agencies? So through evaluation, we have adopted a common nutrition education survey. And so that means that across the 4 agencies, they're all asking the same questions. We did this specifically for adults, and then we just disaggregated that data by race. And so we can see what metrics are doing well. We've also used GIS mapping to do some environmental scans with our, mapping our SNAP-Ed programming and overlaying that with eligible census tracts and zip codes and determining if there's gaps in services, and then building out programming to address that. We've also kind of used a couple of other methods to really engage communities. And they include a community advisory board. This will be our second cohort. And their role is to really kind of be from the community, have lived experience with SNAP, and are willing to share their ideas, their thoughts about how to adapt our program so that it's relevant. They have been really instrumental in providing us initial guidance around our social marketing campaigns. And we really look forward to working with our second cohort, which started a couple weeks ago. We have an agency that is already exploring a youth advisory board. Health Empowers is doing that work. So I wanted to shout them out. They also have, I could be getting the name wrong, but a data jam session where they're essentially working with community members to share back information around outcomes, and then kind of thinking through how to use that information to create a plan. So again, really, not only are we kind of talking to community members, gathering that information, but how can we share that back? How can we kind of co-create a plan of action? And I think these are opportunities to do that. We're also in our first year of a broader needs assessment, and they will include community listening sessions. I think for us, the idea is really providing some context to the quantitative data that we've collected, and really thinking through how can we make these partnerships more mutually beneficial. So we are getting information about how to improve our programs. How can we make this partnership beneficial for community residents who are sharing their expertise? The third is really looking at where there are gaps in services and creating new funding opportunities to bring in new agencies to do that, to do work. And so we are bringing on 2 new agencies this year. We do plan to do that opportunity in the upcoming year. But our goal here again is to look at where are there gaps in services and how can we really target geographic and other areas to really address those gaps in services. And the fourth is really thinking is we put together a workforce assessment, and we I believe it was in 2021. It was really around assessing the workforce's capacity to do equity work, and then providing a set of trainings that really embedded equity in community engagement, implementing policy systems and environmental changes, and evaluation, and then providing the opportunity for agencies to access technical assistance. And so, this work brings up lots of questions about, okay, how do you know if you're doing this work in a way that really honors our community members, that's really moving the needle on improving programming so that it is more effective for those most impacted? And how can we make sure that those efforts are sufficiently resourced so that they are successful? And so we've been exploring kind of adding on to our evaluation. We do adhere to the SNAP-Ed evaluation framework. And so we use some of that language around community champions, really thinking through what might be some other indicators or evaluation questions that we should be exploring to better assess the effectiveness of our work in this space. And so some lessons learned, including to start, I think you can have an assessment, and assessments are good, but I think it's really important to determine where can we start and then start there, being really intentional. So, sometimes this work can be really cyclical. It can be really copy and paste, and we're just kind of going through the motions. And so it takes someone with some real intentional ideas and resources and decision points to say, how have we been intentional about centering community voice here? How have we been really intentional about resourcing these equity efforts? How have we been intentional in creating an inclusive decision-making body? How intentional have we been in using data, not just amongst us, but how have we shared this information with community members to receive their guidance, their understanding about what this means for their communities? And really thinking about how we have, thinking about investing in capacity and staff and skills. Sometimes equity work can be more labor intensive, especially when you're talking about engaging with community members, especially when you're talking about honoring community expertise, when you're talking about sharing back data with community members. That all requires someone to have skills, time, resources. You need a place. You need to be very intentional about how you're communicating this, what's included, what's not. And so all of these things require an investment. And so as much as we want this work to flourish, I think it's really important to think through what are those intentional investments in our capacity to do this work. And then really thinking about how can we explore evaluation indicators outside of the SNAP-Ed evaluation framework. I think the framework is great. I think that if we are going to be exploring what equity looks like, we're going to need some additional indicators, and we're going to need some additional an additional lens to do this kind of work. And I think there might be other fields of discipline that have started looking at these measures. And so really exploring those as we evaluate the effectiveness of our equity work. So that's all I have for today. And if you have any questions, I can answer them in the Q&A. And I'll turn it back over to start sharing my screen.
We've got one more presentation from Tandy and Janice.
I think next slide, maybe. Okay. Hello and welcome. I guess as my name is Tandy Rendis with K-State Research and Extension in the SNAP Education Program. And I'll let my coworker.
And I'm Janice Simon. I'm the partner with her on the Tribal Food System project.
And as Kansas State University is an 1862 land grant institution, it is the SNAP-Ed implementing agency in Kansas, but to connect and support an equitable relationship with our indigenous communities, our Native American tribes in Kansas. This definitely took a unique collaboration and partnership in Kansas. As you can see by the front slide here, this was an opportunity to connect and work with the American Heart Association, the Sunflower Foundation, and then we also continue to work and support with our partners at the Southern Plains Tribal Health Board. So we're going to tell you a little bit more about this collaboration and kind of what we've done with that in the past 3 years. So next slide. Of course, the core and key partnerships that are part of this there are 4 federally recognized tribes in Kansas. And as you can kind of see by the map, you can see where they're also kind of located. The Iowa tribe of Kansas and Nebraska, and then the Sac and Fox Nation of Missouri in Kansas and Nebraska are 2 smaller communities in the very northern part of the state. The Kickapoo tribe in Kansas, and then our Prairie Band Potawatomi Nation. So these are the tribal communities that we had begun this opportunity to collaborate with through Kansas State and our other partners. So next slide, please. How this kind of comes about and comes to the table is then in 2012, and as Ledfrey says, and even Teresa, this takes time. So in 2012, the Kansas Department of Health and Environment used a Healthy Kansans 2020 framework for the 4 federally recognized tribes in Kansas to come together to discuss community health assessments that were being done in that year. And over time, this evolved into an annual meeting called the Kansas Tribal Health Summit. In 2015, with support from the Sunflower Foundation, it increased the capacity of that Tribal Health Summit and their planning committee. So the summit grows in size and scope, but the committee also begins to offer additional trainings and education. And then the American Heart Association came to the picture as a fiscal agent and coordination of support for this Tribal Health Summit and the planning committee. Now, next slide, please, is how K-State and Kansas State University enters into this picture. It begins here with the committee and the connection to the American Heart Association and Sunflower. And so one of the first ways that K-State was involved was the Tribal Health Summit Planning Committee wanted to have some opportunities for just general nutrition classes and health information provided in community, and they reached out to the native chef Jason Champagne to do that work. And so you may know who he is, or if not, has been a wonderful partner in this work as well. So, he was the base in the beginning of some of that work, and coming into all 4 communities and doing even just basic cooking demonstrations, and that idea of eating with our eyes. But then we took that time with him and with Chef Jason kind of to the next step. In the fall of 2018, we added some additional conversations to one of Chef Jason's classes that kind of explored what are the health issues of the communities themselves, and trying to get that local voice for what was being seen as needed. And again, these were ways that, Kansas State University didn't have connection initially, but was able to collaborate and partner through the Tribal Health Summit work to be able to continue and develop maybe what this could look like. And again, hear from the tribal members themselves for that, what this need might be. So next slide, please. It evolved into a second pilot that we called the Tribal Food Systems. And it was meant to be a 3-year project to increase then culturally tailored nutrition education when possible, healthy food choices, and maybe a Kansas Tribal Food System plan. The Health Summit Planning Committee had representation from all 4 of the tribal communities. So they were an advisory role to this, because they, again, we were working to connect with, but not always directly with, the tribal councils for every little detail and informational piece. We were working through the Summit Planning Committee and their representatives in their different community organizations too, in the tribal communities. Obviously, key and core partners are the communities themselves. A project coordinator for the work was hired, and that's how Janice comes to the work. We also began with this knowing that, or thinking that Kansas State University could not actually maybe take in additional funds from partners to support this work. So we worked through American Heart as a fiscal agent. And so Janice, when she began this work, was actually an employee of the American Heart Association. Excuse me, we were able to hire some peer educators though, members of the tribal communities to do some healthy cooking classes, and Chef Jason was our consultant in this phase too. Next slide, please.
Okay, on the food system and the food and gardening part, we did use Chef Jason, and we started out with 5 nutrition assistants. We all got trained, everybody was ready to go. We met with the communities, had everybody's schedule set up, and then COVID happened. So instead of doing in-person classes, we got trained on Zoom. Our nutrition assistants were some of the first ones in the state of Kansas to do the virtual classes. And we did have a good response. We did have people participating. It was nice because our nutrition assistants just seamlessly changed to Zoom. They were okay with it. The only problem we had with that was maybe people having internet services. Sometimes they might have had to go somewhere else, or just we had to operate in different ways. We also worked on community gardens. And this is something we do with K-State. And it started years before I was even doing it, but we still help with it. Usually it's with the DPP programs, the diabetes programs with the tribes, EPA, and it kind of just depends how the tribes are set up, who they assign to us to do the community gardens. Some of the tribes, they get their staff involved. Some of the tribes, it's real community-based. It just depends how they are, but it's always a good project. We also do food pres classes. We do gardening workshops. We help provide equipment for those classes. We do incentives. We do giveaways with the classes, and they're all community-based. Next slide, please. This is one of the classes that Dr. Barden from K-State did at the Prairie Band Potawatomis. And what they do is also, other than educating people on pest control and answering questions they have about their own gardens, they can do soil testing. They provide plants. They give us starters for salsa gardens. And they also do some giveaways on hoses and plant cover, ground cover. It is really well received. And some of the communities do have gardening competitions, and this is something that's usually everybody looks forward to. And we already have our session set up for this coming spring also. But he does one at Prairie Band Potawatomis, one at Kickapoo's. And this year we're looking at doing one at the Iowas as well. Next slide. This is a page we put together about the things we did over that first year. The top picture is all of our nutrition assistants getting trained. And Misty and Chef Jason there is in the picture. And then this is our gardens. We also did some traditional food. We did a short video on drying squash because that's a big thing for us. And then we also did corn, Indian corn in our garden, and dried that and gave the corn out to some of the elders that usually can't get out and do this because it is a process. If you want to just read through that page there for a minute. Again, this is still working through the pandemic and just everybody keeping their distance. We offered everything virtually. If we did meet with anybody, we had to wear a mask, and we still made it through. Next slide. This is another info page that we did with the Sac and Fox Garden. We did raised garden beds, and that we did in conjunction with SNAP-Ed and KSRE and the tribes, diabetes programs. This was a real productive garden at Sac and Fox Nation in Missouri, mainly done by their employees, and we had a couple of community volunteers. It just really took off, and it's still going strong. And we'll be getting ready to do that. And they did tomatoes, green peppers, onions, herb. They had these little herb tubs they did, and then in the middle they had a pollinator tub that was really went well. We also helped with the Sunday Fun Day, in that we had to go virtual for what, 3 years? Or we did a drive-through event, and usually it's in person. It's a all-day community event that we host for all the tribes to come down. We give out swag bags. Hopefully this year we will be in person if we get to do it again, and join the new group that's kind of regrouping the coalition. This is usually sponsored by all the tribes, K-State, American Heart Association, AARP. We've had all kinds of partners on this, and everybody, it's a chance to showcase their programs. Next page, or next slide. Again, we do food preservation classes, and that's usually doing a salsa class, and we do it on all the reservations, and give away canning items, and a lot of good incentives. This past year, we did do a meat canning class, which was different. We did pressure cook some deer and bison, so everybody goes home with a product. That was really well received. It's very different than the salsa gardens. This is always a well-attended classes, the food preservation, because what we did learn out of COVID is just how fragile our food system is. And there was a lot of people hurting for groceries. They had to come up with new ways to meet their needs for getting groceries. The Prairie Band Potawatomi did a commissary for tribal members and community tribal members from the other tribes at their casino to come and pick up the basic necessities, because everything was sold out at the stores. We also work with the Kickapoo Boys and Girls Clubs and doing nutrition classes, some kind of hands-on stuff with the kids. And then we still do gardens with them also, and other nutrition classes. And there's 3 of the tribes that have Boys and Girls Clubs, and they are well attended. We work with the directors. They always look forward to this. Next slide. Here's some pictures of some of the sessions we did at the Boys and Girls Clubs. And okay, Create Better Health is one of the curriculums we do. We are getting ready to offer Turtle Island Tales. I always want to say Turtle Mountain because I know a lot of Turtle Mountain people, but the Turtle Island Tales, and that's geared towards 3 to 8-year-olds curriculum. And we are working with the Head Start at Prairie Band Potawatomi as our pilot project. We will open it up once we see how this goes and work with some of the other tribes. The Boys and Girls Clubs, they're always open to working with us. The kids really want to learn. They really want to learn about food. They really want to learn about gardening. We try and do as much as we can and send home information for the parents. And this is always usually during the summer, just because we don't want to get involved with their regular schedule with the school year. Tandy, do you have anything to add?
No, let's go to the next slide. As you can see from that past slide, we are in transition in this program. It was a 3-year pilot, and you probably also heard maybe several things you might not have thought of doing, maybe with SNAP Ed dollars or even university dollars. And that's truly what collaborative work has meant to us. The combination of the private funding, the nonprofit type of funding, and then the federal funds working together so that we could do and expand the work into our tribal communities in the way that has worked, or I guess means something there, in that, so SNAP Ed funds don't allow you to, you're to provide a taste test where you're doing a class. And yet Sunflower Foundation was very supportive of us being able to do community meals if we were doing adult classes, and provide that bigger piece in terms of that community eating together, and the giveaway pieces as well, and support for all that type of stuff. So I think, as Janice was explaining, that collaboration, the collaboration with the different entities within each tribe, whether it was the EPA, their DPP, or Boys and Girls Clubs. So in our conclusion slide here, the key to building more equitable SNAP-Ed collaborations among land-grant universities, state community partners. Some of it was luck for us, maybe in Kansas, when we were able to connect to the Tribal Health Summit Planning Group that was coming together in support of all 4 tribes and meeting on a regular basis together in relation to those community health needs assessments. You want to talk about thinking outside the box?
Well, yeah, on thinking outside the box, we have worked with different programs, trying to hit different age groups, trying to hit those young parents that usually don't get to attend some of these classes. Also, just keeping the tribes informed of what you're doing, working with programs that you may not have considered before, like, yeah, EPA, the land programs, the DPP, which sounds pretty obvious, but yeah, they all have money to help with plants. They all have money to help with incentives. Also on our community health of the coalition, we had one member from each council on there that we worked with, and that we worked, shared information with to let them know what we're doing, what we're planning. They served on our committee. They participated in community events. It's just trying to include everybody and be as transparent as possible.
Definitely. And like I said, our last point on the slide was listening for that tribal member reported need, not going in and saying, here, I've got this and we're going to do this. What was the biggest concern for health? That was one of those initial questions that we were asking more about with Chef Jason, and continuing to look at that and continuing to connect as Southern Plains Tribal Health Board is looking at that work too, as Janice said, another partner. So that's our presentation. Thank you.
Thank you.
All right, so thank you to all of our panelists, and maybe Marie, we can go ahead and stop sharing the screen so that we can all come up. Thank you for Q&A. So one, I'll encourage everybody in the audience, as we're talking, any questions that come to mind, please feel free to drop in the Q&A box. I see that Teresa already answered one earlier. And then if you have comments as we're talking or want to speak with one another about things that are inspiring you, then I encourage you to use the chat box. I've been reading some of the comments that have been coming through from all of you as our presenters have been going through their presentations. But, anytime that I listen to these presentations, I try to come up with a couple of questions to pose to everyone. So let's get started. And even to our panelists, as we're getting into conversation, if there's something that you want to spark conversation with amongst one another, or questions you have one another, then I encourage that as well. But Teresa, you were talking in your presentation about mainstream models, and I'm going to steal your terminology there, mainstream models and programs, and this belief that tribal communities can immediately begin resolving issues, but there is all of this complex social, cultural, historical, and political considerations to bring into this, and very importantly, relationship building. So I kind of want to get into this aspect of time, because these same models and programs, they don't necessarily have a design that allows for that time that is needed. So just thoughts from everyone on how can organizations push against that and shift that status quo?
Sure. And I'm happy to start. I think one of the big things for us is just, continuously communicating the need for time to build these engaging and thoughtful relationships to the folks at the state agency and regional coordinators and, the national office, because it's not something that can happen overnight. And so I think it's on all of us who work in SNAP-Ed to continuously lift that up and, make that known, because, it can't happen at the snap of a finger. And to really, we all want more healthful communities. We all want health equity for the folks that we work with. And I think that, you know, it's just one of those things that can easily get brushed by, but I think that it's important for all of us to advocate for more time to really do the work that we do.
I think that it's a good idea to identify where the urgency is coming from. There are times when they're, you know, when I'm doing contracts, those are very urgent. Those are very timely. Sometimes it's a good idea to say, who specifically told you that you had a specific deadline for this specific intervention? Because some of those ideas are we impose those deadlines on ourselves. Sometimes it might be coming from a supervisor. It might be coming from someone so I think it's good to identify who is placing time restrictions on when work can be completed, developing relationships, and then talking to those specific people and pushing back and saying, developing trust takes time. Developing mutually beneficial partnerships take time. And so the ask should be, give us the time. It may not take one federal fiscal year. You know, it's kind of like dating. You kind of get to know each other, and sometimes you're just talking, and then sometimes you might want to see somebody a little bit more. So you start talking about a contract, and then leaderships change. So there's all of these multiple factors, and it's a good idea to communicate. There are multiple things that are happening here, and we're going to need time in order to create a solid relationship. So it'd be really helpful if the timeline on the outcomes, the deliverables for this partnership can be pushed out further than, you know, maybe a couple months. So identify who's pushing those timelines and then effectively communicating all that goes into partnership development.
I agree. And I really like Teresa's approach to this also. It takes time to get that buy-in from each community. For me, I know most of the people in these tribal communities, and that's kind of why I got hired, was they wanted the auntie grandma person, which, yeah, you could probably go there and Tandy will tell you, I know a lot of people, and Indian country is pretty small. So yeah, you want somebody they're going to trust. You want somebody that's going to show up, not just for your own functions, but be there for walks, be there for community events, be there for powwows, help out. We've sponsored food for different events. We help with health fairs. Be in those communities and be present.
And I would echo that in terms of, so as I am the employee of the Land Grant University, being present was also very huge in that. You know, Janice may live closer and have that connection, but it didn't mean that I didn't need to show up and put names with faces, and faces with, my people put, my name with my face. And again, same idea, know that I'm there to be in relationship and support, that relationship building takes time.
And just meeting people where they're at, like maybe they're not ready for a kitchen in the commodity program or whatever. They're still just trying to figure out how do we get our commodities picked up, or how do we cook some of this stuff, or how do we get SNAP Ed, and what there's just real basic things that are still going on, especially after COVID.
And I'll just point out that some of our panelists are typing some responses in the chat right now. So while that's happening, I'll ask a few more questions to just keeping this conversation going. So still in that idea of shifting mainstream modeling and programming. How can we, and I don't know if push is the word that I want to use, but this is the word that I'll use, push to not just integrate, but to prioritize and honor Indigenous and community-derived knowledge into every aspect of the programming.
Start again.
Working with families, a lot of times it's generational. It's not just mom, dad, and the kids. It's usually mom, dad, kids, uncle. It's a very tight-knit community.
And I think, sometimes you have to start not with like, here's our program and here's what we want to do. Sometimes you have to start with where, what are some of the assets in your community? What activities, what, social circles, just starting where there might be good opportunities or assets in communities, and just having people talk about their experience. Because I think that, some people approach this work as like, here are the checklists and here are the things we need to do. And those are really important, but you're working with people who have a variety of experiences, and they are honoring you with their time, by showing up. And so I think sometimes it's a really good idea to just talk about what's going on in their communities. How are they doing? How are their families? Are there any kind of important events that they want to discuss? And really giving those times during, nutrition education classes, during demos, when you're in your partnership meetings, when you're in your coalition meetings, just talking to people about their experiences in their lives and starting from there. Because there's a lot of people who do not believe that their voices are valuable. And I think part of this work is really connecting to human beings and recognizing that our programs are really important, but to never kind of supersede the fact that we are working with humans, and we want to connect to their human experience before we kind of, start our checklist.
And Teresa, I mean, before we move on to some more questions, is there anything that you wanted to add?
No, but I love that, connecting to that human experience.
Yeah, and I think, that sometimes, yes, programming can get separated, program systems, all of these things can get very separated from, that very basic unit of humanity. So, and I think, that one of the other questions I had, Latrice, you started kind of connecting to, you talked about disaggregating data in your presentation. And what I was thinking about was equity opportunities and data collection and the metrics themselves. And we spoke, more to this later in your presentation, but any thoughts from anyone on, not just the analysis of the data that we collect for the program, but that point of data collection itself and the metrics that we use to incorporate or prioritize equity?
Sure. So I'll share from our experience working with our tribal partners, our sovereign nations here in Oklahoma. I think first and foremost, you have to think about who owns the data. And so just taking that step back, because here in Oklahoma, some of the tribes do have their own institutional review boards. And so that is also, first and foremost, we're running everything through that institutional review board. But then kind of to cover where OKTEP is not in a university setting, we use the Oklahoma City area Indian Health Service Institutional Review Board to review all of our data collection and processes. And so for the tribes here that do not have their own tribal institutional review board or committee or someone who's overseeing that, we do have, they will oftentimes grant permission for that IHS, the Oklahoma City IHS Institutional Review Board, to provide oversight of that as well. And I think the big thing there is that is a big part of owning that past history, is knowing that in the past, there's been a lot of detrimental things done with our Native population. And so it's important that you first address that, you know, and go in and plan. And again, it takes time to go through multiple IRBs for data collection, but it's absolutely needed and something that we have to do.
And I think that speaks to one of the responses that Latrice was giving in the Q&A box about recognizing harm. And that, yes, when we go there, that means that accountability is very important, but that does not mean it's necessarily going to lead to partnership. And you have to understand that then, going back to what we said about time and relationship building, that becomes a part of the repair process, even if it does not end up in, you know, our programmatic partnerships in the end. We still have that commitment to one another from that humanity aspect. Anyone else want to talk a little bit about the data?
I'll just add that data in itself has its own kind of, you know, it's like who owns it, who gets to interpret it, how is that data shared, what contexts are provided, specifically if it's just like quantitative data, you know, it kind of gives you the what, but not necessarily the why. And so when there's very little context around why there might be disparate outcomes, people will tend to kind of reinforce their existing narratives. And so it becomes really important, specifically if which I advocate for, which is sharing back data to community members, is as we are doing this, being very intentional about here's what this data is saying, here's what the data isn't saying, here's right. If the data is saying this, and I'm pretty sure I'm not saying that right, data are, data is, but if this is what the data is saying, these are the limitations. This is what we can't imply these results. This is the information that we can imply based on what we have. And so it becomes really important because data can be used against communities to create and uphold narratives that are really, really harmful. And community members have no control of that. Their communities are painted in a specific picture. And so it becomes a question of not only who owns that data, but who owns the interpretation of that data. And it becomes really important to recognize that our role should be in our process of accountability, thinking through what process do we need to put in place to ensure that the information that I'm sharing back with community members are reflective of what is accurate, and then what we share broadly outside of community members includes the way that community members see and understand that data. So I'll end there.
Therese, you brought that all full circle and connected everything. So I'm recognizing we never have enough time for questions. We're right here at the end of our webinar. So I'm going to ask Marie or Rachel to drop a link to our Qualtrics survey. It's right there in the chat box. 3 minutes. Anybody who's on here, just open that up before you jump off, and please fill it out to give an evaluation of this webinar. We'll also send it out along with the materials, and one question just to close everything out on, realizing we'll go over by just a few minutes, but to each one of you, and I'll start with Tandy and Janice, talked about, Latrice actually brought up sufficiently resourced. So we're going to have short answers to a very complex question, but some closing thoughts on this. But what are the potential investments to make, and kind of, you know, if we actually were well resourced, then what would look different in our mainstream models? Like, what do we need to consider in this? So I'll let you answer that question in whatever way it's resonating with you as a closing thought to this webinar.
Darn, started with us. Hey, Teresa and Latrice, you know, pick up the slack here. So if we were sufficiently resourced, what would that, say that again, Colia?
Yeah, what would it look like? And then, to try to get to that point of being sufficiently resourced, what are the considerations?
I mean, I think with us it really has been allowing the collaborative funding, because, we couldn't do everything with one single stream of funding because of its restrictions. So, that was huge for us in being able to, so essentially that means some of the federal funding that we're working with should truly have less restriction maybe to it.
Yeah.
That's probably huge on our end.
And that's the main part. It's like so many tribes are used to working with federal programs that like, okay, we got this money and we want you to do A, B, and C, but they're not thinking about what the tribes really need or what's going to work for them. It's like somebody giving you some money, but oh, well, I'm going to hold this money in front of you, but you're going to do what I want you to do. So it's like the tribes are so used to that. And it's like they get turned off by that.
Mm-hmm. All right, Latrice and Teresa.
You want to go? Okay. I think, who gets funded would be different. I think how programming is implemented, planned, evaluated would be different if we centered community members that are most impacted. I think the way that work is evaluated would be different. And I think what is funded, I think so much of what we do is kind of, to use the image, like we're just kind of catching people after they fall into the river, and we're not going upstream. And so, ideally we would be doing work that's really preventing people from nutrition insecurity and food insecurity.
Mm-hmm.
Ideally, we doing work that addresses kind of those root causes. And so I'll stop there.
Darn, I should have went first. Of course, Latrice gave a wonderful answer. Completely agree and love that imaging. I think true engagement. I'll just say that, and understanding that. That I think kind of encompasses so much. And, apart from, taking the time to do this work, but then, also just showing up. I think that was something you had said, Janice, before, because that has been so important in the work that we do. Even if we can't provide something, even if we can't give an incentive, just showing up means so much in our communities, that we, take care enough to take the time to be there and to listen and try to learn. I think that is a big part of being engaged in health equity and working with our communities. And so I would just say that really knowing and understanding how to be truly and authentically engaged with our communities.
Mm-hmm. You guys ended this on such a wonderful note. That is the beginning of a conversation for another series, another webinar that honestly goes beyond even SNAP-Ed. So as we are wrapping up this series, I just want to take a moment to thank our panelists, Tandy Rundis, Janice Simon, Teresa Jackson, and Latrice Davenport. And we will be sending out the materials within the next couple of days. And please keep in touch with us through the Racial Equity in the Food System Work Group. Thank you all for being here, and take care. All right, we'll go ahead and stop the recording.